10 million undocumented immigrants nationwide and no access to health care. Everyday immigrant mothers, fathers, and children of documented and undocumented immigrants live in fear of getting sick or injured. They know that without health insurance, what little money they do have will be gone and they'll be in debt for years to come. In a recent article in the Journal of Urban Health says there's currently 3.5 million immigrants living in Los Angeles County, accounting for 22% of all immigrants nationwide. Now, I've been working closely with this community for the past 10 years as a healthcare worker, and the one thing I've noticed is that a number of the medical issues they face could have been avoided with the most minimal of preventive care. The state of California offers a variety of programs to help documented and undocumented immigrants receive medical assistance and insurance. I propose that we should hold a bi-monthly healthcare workshop for the people in the immigrant community located in downtown Los Angeles. In this workshop, we will provide contact information and assistance, helping families register with the various government, federal, and state programs afforded to them. The healthcare workshop will have 2 advisor interpreters present to assist families with understanding and applying to the various programs. We will supply a multilingual information pamphlet to take home in accordance with the National Class Standards of Communication and Assistance. These handout materials will be offered in Spanish, Mandarin, Armenian, and Russian. We've based the languages based on a 2019 census report by the University of Southern California Dornsife. The staff workshop will consist of the 2 interpreter assistants, a program director providing the presentations and information, and a state licensed social worker to assist the families with any issues unforeseen. The healthcare professionals will explain the many government assistance programs such as Medicare, Medicaid, and Medi-Cal. We'll be explaining the differences between these programs, what benefits the programs can offer, and what's the eligibility requirements to apply for these programs. We will provide information and assistance to the families applying for the CHIP program, Children's Health Insurance Program, along with helping expecting mothers and mothers of newborn children get the proper vaccinations through the VFC Vaccinations for Children's program. In a recent article, Is Affording Undocumented Immigrants Health Coverage a Radical Proposal, published by the Journal of American Health Association, Lawrence Gosselin, the author, explains that more than 10 million undocumented immigrants in the U.S. are systematically excluded from federal health insurance programs. Professor Gosselin explains how this exclusion actually creates a bigger drain on the public funds. By not including undocumented immigrants into the federal state healthcare programs, the undocumented immigrants don't seek medical attention until their illnesses have become acute or it's a medical emergency. Now, to care for these people once their illness demands emergency care is much more costly than having access to the preventive care in the first place. In this workshop, we will explain which services are available, what immigration statuses are required to receive those benefits. Undocumented immigrants cannot apply to certain programs such as Medicaid and Medicare, but can apply for prenatal services and in some cases can be awarded emergency relief. In an article published by the Social Sciences and Medicine Journal, Immigrant Women's Perception of Health Services, author Heidi Sarabia argues that it's actually secondary staff such as the receptionists, social workers, and technicians that leave the biggest impact on undocumented women's perception of healthcare. It'll be paramount that we take the time to communicate and establish a level of trust and honesty with these families. With this in mind, we intend our workshop to fully comply with national class standards and principles of providing effective, equitable, understandable, and respectful quality care. The workshop will be held on the first floor conference room at Silver Lake Medical Center, downtown Los Angeles, 1711 West Temple Avenue. We're able to use this room free of cost through the Filipino Rotary Club and Silver Lake Administration. The workshop will need to cover the cost of staff, which comes out to an annual salary of $3,614. That covers the cost of the 2 advisor interpreters, the program director, and the state licensed social worker. The cost of supplies is a one-time cost of $612. Now, these supplies will include multilingual pamphlets and contact information to the various government programs, handouts with contact cards, and writing utensils. The total cost of having a bi-monthly workshop is going for a year annually is going to be $4,226. This workshop is created for the benefit of the immigrant community of Los Angeles County. This program was created with strict adherence to the goals and guidelines of the 15 national class standards. This program seeks to educate documented and undocumented immigrants on the options for health care afforded to them by the state and federal government. In an article published by American Nurse Today, Rights and Undocumented People, author Leah Curtin explains differences between legal rights and human rights. She says, human rights are rights inherent to all human beings, whatever our nationality, place of residence, sex, color, religion, or any other status. We are equally entitled to our human rights. She goes on to explain that a person's legal status is a very complex issue, and every person should be given the respect and afforded help regardless of perceived legal status. This program seeks to uphold those ideals and the ideals of the national class standards. My name is P.Wright.